Well, as an advanced practice nurse anesthetist, I found my passion. Very honestly. You always have to think of the need, and believe it or not, in anesthesia, there's lots of time to get to know your patient. I don't just put the monitors on and put them to sleep. In outpatient surgery, you talk to your patients. And because of nurse anesthesia, I found my practice. I found my love. In talking to patients, and they see me at the head of the table, and they say, you know, my child's in college, where should they study? Or they say to me, I really can't afford to be here.
Wow.
Increased co-pays, increased out-of-pocket costs, increased premium, and they tell me they can't meet their needs. Not just my patients, but also my nursing colleagues. They're struggling financially. So for me, I created a company called Roberts Target Financials. And I teach people that debt is a disease. It's a disease that can be cured. So I also created a book, which you're welcome to have, but it walks us through the 5 steps of getting out of debt, creating wealth, and being sustainable. Because I can also tell you that 80% of Americans, including us right here in this room, are living paycheck to paycheck. I can also tell you that 60% of all African American wealth and resources is going towards paying off student loan debt for years. That hinders our ability to buy homes, to put our own children through school. And I can tell you, many of us here have 6, 5, maybe even more of student loan debts. I work with physicians who have $500,000 of debt. So I found my passion as an entrepreneur or a nursepreneur. In addition to that, myself and another BNC member, we created a school. It's called the Summa Prime School of Healthcare. And in that school, we are preparing individuals to go back to the bedside. There has not been a theater of war that African Americans have not been in this country. My dad was in World War II. We've been at every crisis and at every point, and we've managed the care. And as healthcare providers and having a CNA school, I have a number of my students here, having a CNA school, we're putting the providers back at the bedside. And it's essential that we do that as individuals. As nurses, we have the authority to open our own. So I chose entrepreneurship over nurse leadership in order to meet the needs of individuals. Come on, do it, do it, do it.